Okay, so when the RN to BSN program was established and they put the courses in order, most of you have already completed nursing research prior to the community health nursing courses. And this was to provide a background for how nursing knowledge is explored for nurses to provide evidence-based nursing practice in the care of your patients and clients, or in this case, communities. If you have not yet taken the course, here is a brief overview or summary for those who have, related to this important aspect of care in the community health setting. So we'll start with the definitions. What is evidence-based medicine? This is an integration of best research evidence with clinical expertise and client values. Evidence-based public health is an endeavor in which there is an informed, explicit, and judicious use of evidence that has been derived from any of the variety of science and social science research and evaluation methods. For evidence-based nursing, this is an integration of the best evidence available for nursing expertise and the values and preferences of the individuals, families, and communities who are served. And research utilization means the process of transforming research knowledge into practice. Evidence-based practice decisions are supported through a review of the findings from studies. This type of study greatly influences the study's value in changing practice. This is a list of the types of studies, from the highest form of study to the least. So double-blind, randomized controlled trial is the highest level of evidence due to its being double-blind and randomized. This cuts out the possible bias of the study, followed by randomized controlled trials. This means the subjects are randomized and there is a control group, but the researcher knows which group received the intervention and which one did not. Other types of studies are following. Non-randomized clinical studies, these are where the subjects were chosen for convenience. Prospective cohort studies, this follows a group of subjects over a period of time. Case-controlled studies, this is the study of two separate groups, one with disease, one without, used frequently with epidemiology. Case reports are just what it sounds, a case that was experienced, including presentation, treatment, and results. Expert opinion is the opinion of someone who is an expert on the subject through considerable experience. Two common approaches used to explore research findings to impact healthcare decision-making in the community settings are systematic review and a meta-analysis. In a systematic review, you're identifying, appraising, and synthesizing all available research relevant to a particular research question. In a meta-analysis, a specific method of statistical synthesis is used in some systematic reviews, where the results from several studies are quantitatively combined and summarized. Evaluation of evidence. Evidence-based practice decisions result from a comprehensive review of the influence of each of these areas in the study. The value of the findings comes from a thorough critique of the study in these areas. Is it a good sample selection? Were the subjects randomized? Was there any blinding? What is the size of the sample? If the sample is too small, then it's not probably really valid or reliable. But is there a description of the intervention? What are the outcomes? Was there follow-up? And how long did it take? Was there attrition? That means that people drop out of the study. Were there confounding variables, so confusing variables that cause bias? Was there a statistical analysis? All of these areas make argument for whether the evidence is reliable and valid to apply to others if the same condition were present. Implementing evidence-based practice. So you're going to implement the practice. So you're going to ask the research question. You want to include the problem, the population, the intervention or exposure, and comparison and outcomes. You need to collect more relevant and best evidence, making a clinical decision or change, integrating all the evidence with clinical expertise, client preferences, and values. Okay, so access to evidence may be limited in this area of practice. Community health nursing is a growing area of practice, but research has not kept up. Clinical practice guidelines may apply in this setting or may need to be adapted to the community setting due to the realities of the practice setting. Cost, time, funding, and knowledge and resources limit real application in this area of practice. Nurses are often threatened by questioning of long-accepted practice. Practice-generated questions for research in the community are some of the following. accessible health care, community involvement, disease prevention and health promotion, appropriate technology in community settings, multi-sectoral approach coming from many different sectors, quantitative studies from health community centers, and qualitative research can add the Y factor. For an example, what is the current best practice for nurses counseling community groups on skin cancer? That would be a really good research question. The following website takes you to the National Guidelines Clearinghouse, and within there is a guideline developed by the U.S. Preventive Services Task Force that applies to the example on the previous slide. You might want to surf around within the Clearinghouse website for all the contributed guidelines that are available for us thus far. You may find one that will assist you in the practicum course when you plan your health promotion project, so keep that in mind. Here are some of the roles and issues in nursing for evidence-based practice. Is there a relationship? Can you develop relationships and partnerships? Do you have good communication technique? And is there communication within the other departments that are involved? You always want to take into consideration the ethical position of the person doing the study and of yourself. The position of the researcher in employment settings. Is there funding for the research? Will there be clinical application of what the research is finding? You always want to benefit the quality of care. You want to make sure there's no health disparities and you have equal distribution of resources. There needs to be control of the financial cost, and you have to take into consideration the managed care organizations as well. I hope this has helped you a little bit to understand evidence-based practice and the use of this practice in the community setting.